An epidural cortisone injection is a steroid injection into the spine. There are many different reasons why patients may need this injection, but the purpose is to get some steroids into the spine and to help them improve. Epidural cortisone injections are helpful because they reduce inflammation. In the spine, when a patient has a problem with a disc or something called stenosis, what ends up happening is a nerve becomes irritated, it becomes inflamed, it will swell up, and that is why patients experience pain. So when we want to help them, we put in steroids, cortisone, and that cortisone will calm the inflammation down. It will shrink the nerve, the swelling, get it down, and that helps because often the nerve is trying to get past the disc, which is bulged or fitting through this tight hole that is what we call stenotic. There are a number of different techniques or ways that doctors can perform an epidural steroid injection. Whether this is done under X-ray guidance, and this equipment that you see here is what is called a fluoroscopic machine. It is X-ray, and here are some typical X-rays. And this is helpful because the doctor then can see where they are putting the needle, and they can advance it under X-ray guidance while they're putting the needle in. It also helps because then once the doctor has gotten that needle into the epidural space, they can confirm that the needle is there. You can see here that this is a picture of the spine, and right now we are looking at the patient through the side of their hip. And so the skin of the back is on this side of the picture and their belly is over here. In this picture, this black line is the needle, and it is difficult to see, but there is a black cloud here, and that is medicine in the actual epidural space, and it is highlighting that epidural space. And this was the confirmation picture in one of my patients. If you can reduce that swelling, then the pain will go away. As far as anesthesia, this procedure in reality is pretty quick, fairly painless, and so the anesthesia for most patients is what we call local anesthesia. Basically, that's where we numb up the skin with some medication. There are some dangers to an epidural steroid injection. We are putting a needle into the area of the spine, and important structures, particularly those nerves, are there. And if you have to undergo these injections, your doctor will sit down and discuss those dangers in detail with you.